Hi, my name is Teresa Buffkin. I'm here today to do a CBC dressing change. First, I'm going to verify the physician orders and gather my equipment. I'm going to identify my patient against the patient's armband. Next, I'm going to identify any allergies the patient may have. Then I'm going to wash my hands, don my clean gloves. Okay, next I'm going to put on a mask, and if my patient was unable to turn their head, I would actually provide a mask, or I'd ask my patient to turn their head away from the insertion site due to contamination. Next I would remove the dressing. Gently remove it, telling the patient that it may feel uncomfortable, but gently remove it, and watch out for the tubing. Alright, I would discard that into the biohazard bag, and there's a bio patch, which is not, but if there was, I would dispose it in the biohazard bag. So next I would assess the site for any redness, swelling, bleeding, drainage. If so, I'd document it or notify the doctor. I'd remove my clean gloves and wash my hands. And next I would get my sterile gloves and apply them. Alright, next I would get my alcohol swab, and for demonstration purposes I'm not going to open it, but I would take one, I would swab it down, discard it into the biohazard bag, and take another one and swab them toward the side and place it up in the biohazard bag. Next I would get the chloroprep, and after that dried I'll get the chloroprep. Demonstration purposes I'm not going to squeeze it, but you squeeze it, and then in a circular motion I'd cleanse from the inside out the CBC dressing site and discard it up in a biohazard bag. Okay, next I'm going to get the new dressing, and I would remove the dressing and apply it over the site and make sure I secure it down, and I would date and time and initial the dressing so the next shift would know when the last time it was dated and changed. Usually it is changed every 7 days, or according to the policy, or if it's sold or anything. And you would end up having a central venous line if a person had chemo, or if given TPN, or a lot of IV treatments or antibiotics, or a lot of fluids, or if you couldn't get access to a peripheral line. Next I would remove my sterile gloves and discard it into a biohazard bag. I'd wash my hands. I'd document the patient's response, the dressing change, and any signs of infection, like any redness, swelling, bleeding, or bruising. And that's it. Thank you.